Did you know that heart disease is the leading cause of death globally, claiming nearly 18 million lives each year? This silent threat lurks unnoticed, often until it's too late. Understanding heart disease and its devastating impact is crucial. More importantly, knowing how to recognize its early warning signs can save lives. From subtle symptoms to alarming alerts, these signs are your body's way of signaling help. In this video, we will discuss 15 early warning signs of heart disease that you should never ignore. The first sign is chest discomfort. Often described as an uncomfortable pressure, squeezing, fullness or pain in the center of the chest, this symptom can last for a few minutes or come and go. While it's easy to dismiss as mere indigestion or stress, it's important to recognize that chest discomfort is a classic symptom of heart issues, especially if it occurs during physical activity or is accompanied by other symptoms like sweating or shortness of breath. Take action by consulting a healthcare professional to assess your heart health. Remember, chest discomfort is not something to brush off. The second sign is shortness of breath. Often dismissed as a minor issue, feeling unusually winded from simple activities like walking up a flight of stairs could be a red flag. Your heart struggles to pump oxygen-rich blood effectively when it's not functioning properly, resulting in this breathlessness. To stay ahead, monitor how often you feel short of breath and under what circumstances. Regular cardiovascular exercise and avoiding smoking can greatly improve your heart's health. Remember, shortness of breath could be a sign of an underlying heart condition. Signs 3 to 5 include fatigue, dizziness, and nausea. First up, we have fatigue. This is not just your garden variety tiredness. This is a profound, often overwhelming sense of exhaustion that doesn't get better with rest. If your heart isn't pumping blood as well as it should, your body can struggle to get the oxygen and nutrients it needs, leaving you feeling wiped out. Next, we have dizziness. When your heart isn't doing its job properly, your blood pressure can drop, causing feelings of lightheadedness or even fainting. This isn't something to be brushed off as a momentary spell. It's a sign that something could be very wrong. Finally, there's nausea, often coupled with stomach discomfort or indigestion. This is because a struggling heart can cause digestive system issues, leading to feelings of queasiness or a lack of appetite. So if you're experiencing fatigue, dizziness, or nausea, don't chalk it up to a bad day. These signs should not be taken lightly. Signs 6 to 8 are irregular heartbeat, swelling, and sweating. First up, irregular heartbeat, medically termed arrhythmia, might feel like your heart is skipping beats, fluttering, or beating too hard or too fast. This can be a mere annoyance or a harbinger of something more severe, such as heart disease or an impending heart attack. Next, let's talk about swelling. Often observed in the feet, ankles, legs, or abdomen, this symptom shouldn't be brushed aside. Swelling can indicate that your heart isn't pumping blood as effectively as it should, leading to fluid accumulation in your tissues. Keeping your body active and reducing salt intake can help manage and prevent this condition. Lastly, excessive sweating, especially when you're not exerting yourself, is another sign to watch out for. It could indicate that your heart is working harder than normal to pump blood. Together, these signs should not be ignored, as they could be early indicators of heart disease. Stay vigilant and consult a healthcare provider if you experience any of these symptoms. Scene script. Signs 9 to 11 include pain in other parts of the body, snoring, and throat or jaw pain. First up, pain in other parts of the body. It's not just your chest that can signal heart trouble. Pain in areas like the shoulders, arms, back, or even the stomach can also be a red flag. This kind of pain might feel different from the usual soreness after exercise. It can be more of a persistent ache or an unusual pressure. Moving on to snoring. While it might just be a nuisance to your bed partner, loud snoring, especially when it's punctuated by pauses in breathing, could be a sign of sleep apnea. This condition is linked to increased heart disease risk because it disrupts your normal sleep patterns and puts extra stress on your heart overnight. Lastly, let's talk about throat or jaw pain. Often overlooked, pain or discomfort in these areas, particularly if it's triggered or worsened by exertion, could actually be radiating from the heart. These symptoms may seem unrelated, but they could indicate a heart problem. The final 4 signs are persistent cough, rapid weight gain, frequent fainting, and skin rashes or unusual spots. Let's delve into these symptoms and their implications. A persistent cough, one that lasts for more than a few weeks or produces white or pink mucus, might be a sign that your heart isn't pumping as well as it should. This can lead to fluid buildup in the lungs, causing the cough. If you've been coughing for a longer period, don't just write it off as a seasonal allergy or a cold. It might be time to consult your physician. Next, we have rapid weight gain. If you find yourself gaining weight at an unusually fast pace, it might be due to fluid retention, a common symptom of heart failure. This isn't about a few extra pounds from holiday feasting, but rather a sudden increase of 3 to 5 pounds in a week. Frequent fainting spells are another red flag. They can indicate a drop in blood pressure, often linked to a heart condition. This isn't about a one-time fainting episode, but rather a pattern of fainting spells that seem unconnected to any external factors. Lastly, skin rashes or unusual spots can be associated with heart disease. Certain conditions like eczema and shingles have been linked to increased risk of heart disease. So, those skin changes might be more than just skin deep. These may seem like minor issues, but they could be early signs of heart disease. Recognizing these early warning signs is crucial in the battle against heart disease. Early detection of heart disease is not just about identifying a problem, it's about taking action, about empowering ourselves to make the necessary lifestyle changes and seeking medical intervention before it's too late. It's a proactive approach, not reactive. It's about preventing a potential health crisis before it happens. The importance of early detection cannot be overstated. It's akin to spotting a storm on the horizon before it hits. We can't change the weather, but we can certainly prepare for it, minimizing the damage and ensuring our safety. Similarly, detecting heart disease in its early stages allows us to take action, to seek the right treatment, and most importantly, to make the lifestyle changes that can halt or even reverse the progression of the disease. Consider it this way. Heart disease is like a ticking time bomb. The earlier we spot it, the more time we have to defuse it. It gives us a fighting chance, a window of opportunity to intervene and change the course of our health. Early detection isn't just about prolonging life, but also about improving the quality of that life. It's about living not just longer, but healthier, happier, and with less worry. It's about being there for the milestones, the graduations, the weddings, the birthdays, and all the precious moments that make life worth living. So, how do we achieve early detection? It starts with awareness, with recognizing the signs we've discussed. It requires regular checkups and screenings. It requires us to listen to our bodies, to pay attention to what they're telling us. In the end, early detection is a commitment, a pledge to ourselves and our loved ones to prioritize our health, to take care of the hearts that keep us alive and thriving. Because when it comes to heart disease, time is of the essence. Every moment matters. Every heartbeat counts. Early detection can save lives. But recognizing the signs is just the first step. Heart disease remains one of the top health challenges worldwide. But the journey to heart health doesn't end with merely identifying the warning signs. Regular health checkups play a pivotal role in not just recognizing but actively managing and preventing heart conditions. Think of regular health checkups as a form of self-care that goes beyond the superficial. These visits to the doctor are essential, as they provide a detailed overview of one's current health status, highlighting potential risks that aren't always apparent through everyday symptoms. For heart health, specifically, these checkups can monitor blood pressure, cholesterol levels, and other crucial markers that could signify heart disease. Moreover, during these checkups, doctors can conduct a variety of tests tailored to cardiovascular health. These might include an electrocardiogram, EKG, to check the heart's electrical activity, or a stress test to see how the heart performs under physical strain. Such tests are vital, as they can detect issues like blockages or heart rhythm irregularities before they turn into severe problems. It's also a chance for individuals to discuss their lifestyle with a healthcare professional. Diet, exercise, and even stress levels can dramatically influence heart health. A regular dialogue with a doctor can lead to personalized advice and strategies tailored to individual health needs and habits, making prevention as effective as possible. Furthermore, these checkups are a great opportunity to review and adjust medications. Many heart conditions are managed not just with lifestyle changes, but also with medication. Regular reviews ensure that the medication is still the best choice and that it's working effectively without undesirable side effects. In essence, regular health checkups are not just about prevention, but are a proactive approach to managing and optimizing heart health. By making these checkups a routine part of life, potential heart issues can be addressed long before they become life-threatening, ensuring a longer, healthier life. Regular health checkups can help catch heart disease early and improve outcomes. In conclusion, heart disease is a silent killer that can be stopped with early detection. From chest discomfort and shortness of breath to more subtle signs like fatigue, dizziness, and nausea, each warning signal is a crucial call to action. Don't overlook symptoms like irregular heartbeat, swelling, sweating, or even persistent coughing and rapid weight gain. Pain in unexpected areas, snoring, and skin changes also make the list. Remember, your health is in your hands. Don't ignore these signs and take action today.